Good morning, everyone, and thank you, Dean Cronk-Warner. We're grateful for your support and for the support of the college. It is my pleasure and honor to welcome our opening keynote speaker, Nsedu Obot Witherspoon, who is the Executive Director for the Children's Environmental Health Network. She has been an advocate for children's environmental health for over 24 years and is a true leader in this field. Her accomplishments and expertise are wide-ranging and extensive, so I won't take too long, but let me just highlight a few. She has served on the External Science Board for the Environmental Influences on Child Health Outcomes, the NIH Research Network. She has been a co-leader for the Health Science Initiative for the Cancer-Free Economy Network. As well, she has been co-chair for America, the Beautiful for All Coalition, and the lead chair for the Clean Water for All Coalition. Among many other accomplishments, she is a proud mother of 4 children. Her opening keynote today is entitled, Failing Our Children is Not an Option, Equal Protection for All Children and Their Futures. Please join with me in welcoming to the podium Nsedu Obot Witherspoon.
Good morning. Oh, come on. I know it's early. There we go. Good morning. It's really good to be here. It's quite an honor to be here. I'm coming in from the Chesapeake Bay around Maryland, where I presented yesterday at a big environmental summit, a big tent, if you will. We haven't had one of those in a while, where you have big greens, community groups, justice groups, public health, faith-based groups, you name it, coming together, just trying to steer the course for a much brighter future. And the governor of Maryland, Governor Wes Moore, kind of closed us out and really imparted what I do believe we are seeing, that the trends will continue to happen at our states and our cities in particular. Well, many of us continue to work at the federal level, and we will beat down those doors and do what we can to make sure public health and protection of our most vulnerable remains a priority. I just want to stress that symposiums and symposiums like this are really, really important. So it is, I just want to emphasize what your dean mentioned earlier. It's really an honor to be here. Congratulations on this and on this anniversary, and looking forward to the discussions throughout the day. So it's really important, protecting children and our most vulnerable should not be as hard as it actually has been. So every day I try to ground myself with some type of ancestral connection. Today, it's going to be Nelson Mandela. There can be no keener revelation of a society's soul than the way in which it treats its children. So I'd like you to just continue to keep that as the backdrop. The bottom line is that our children continue to tell us that they are not well. So if you don't know us, which is fine, we've been around 33 years. We're the Children's Environmental Health Network, national nonprofit that's been working to protect all children from environmental hazards and now the changing climate. We got our, what's happening? Okay, we got our start out in the Bay Area, actually in the late 80s. And I'm the 3rd director in line, and I promise you the founding director, Joy Carlson, never thought that there would be a need for 3 decades of work. At that time, healthcare professionals were coming in, and they were acknowledging that they were misdiagnosing their patients to what we now know to be increased asthma and respiratory illness from air pollution, pesticide exposure from the agricultural fields, and especially the occupational exposure from those parents bringing that home to their own families. Pregnant moms being exposed on the fields, mercury exposures. That then turned into the first ever curriculum to advance and train child healthcare professionals, which we still work with a lot. And then we realized it wasn't just the state of California that needed an agenda to protect the most vulnerable. It was the entire nation, and we got started in '92 going nationally. Our work has always been to protect the science and to promote and stimulate the science. A big part of our work is in translation of science, so that's translating available lived experience in science into education, curriculum, technical assistance, trainings. And we do work for child protective policies that put children at the center, which is very rare to see. But again, we are seeing our states taking more of the leadership role there. I also want to mention an incredible jewel you have here in the Salt Lake area. Hester Paul is our National Director of the Eco Healthy Childcare Program. Yes. If you don't know her, get to know Hester. Her and her family live here, and I'm going to talk more about that program. And we have staff in different parts of the country as well. So I think there was supposed to be a clicker, but I will just, I don't know why it's not advancing. Oh, no. Sorry, I was told there was going to be a clicker, but don't see. Up here, okay. Thank you. So we've just gone through the whole presentation. Yeah, we just need to go back to the beginning. This is the last slide. Sorry about that. Yeah. There we go. I'm like here.
This guy?
Yeah.
Sorry about
Thank you.
that.
There we go.
Good.
But you guys aren't seeing that.
All right, let me super drive for a second here. I don't know what it's doing.
That's okay. There we go.
We'll click through.
All right. Thank you. So it's really important to understand the landscape that we are in. We are not working in our own communities. That's really important. But in this global scene, globally, 1 in 4 deaths among children, unfortunately, under the age of 5, are now associated with polluted environments. It's even to the point where some death certificates around the world are starting to mention air pollution as a source of death. This is how detrimental this has gotten. So why children? Why an organization that has to continue to be a champion for children? The reality is the air that they're breathing and that we're all breathing, the food that they are intaking, the water that they are exposed to and intaking, consumer products, products that are marketed to them, their toys, their cosmetics and other things that they come in contact with, their cribs, their furnitures, you name it. All of these put children at harm's way, all of us as well, but there are specific reasons that children are very vulnerable. They have higher exposures. First of all, they have higher latency, and unfortunately, every child in this world is now born pre-polluted. So just to let you know, we're gonna get gets a little depressing first, but then we're going to switch it up and we're going to get more optimal. But it's important for us all to be on the same track about the urgency and crisis that we are talking about. So prenatally, the first environment is mom's womb. So we do know that pregnant moms, parents, dads, and now even grandparents, what grandparents are exposed to is now showing up in their grandchildren. So every child is born, if you will, pre-polluted. That's not exactly the trajectory that we expect for nurturing and cultivating health and well-being for children, as they have so many other challenges in life to overcome. Their little systems were never meant to metabolize and work through these very harsh chemicals that were never meant to enter the human system. Their respiratory systems, their neurological systems, the brain is still developing into toddler years. Their musculoskeletal system, all of this puts them in harm's way. And what are children doing? Their behavior, they're on the ground, they're crawling, they're putting their hands in their mouth, as they should. But unfortunately, that behavior also puts them at risk. And these are just a few of these exposures. A lot of them you'll see in the home. Our built environment structures are extremely important. Children spend a lot of time in childcare, homes, schools. Unfortunately, like adults, spending a lot of time indoors, maybe not here in this region. I think a lot of folks do get outside and we need much more of that. But we do have to acknowledge the indoor environment is much different than the outdoor. They impact each other, but we need to address them in a separate way. And there's about 84,000, 90,000, I've seen many different numbers. The point is we have many hundreds of thousands of synthetically provided chemicals that enter our market every single year, and they are not tested for human impact and public health. So there are these windows of susceptibility. So there are these different growth patterns in the regular gestation of neonatal development. And it is important to remember, again, children are at harm throughout all stages, but specifically if you're talking about the central nervous system, it's going to be a little later on in the pregnancy. If it's the brain, it's going to be, again, maybe third quarter. Ears and autoimmune and respiratory. So these have been proven time and time again in peer-reviewed structure that it's not a question of whether children are being impacted. It's happening, and we need to do something about it. What we also know from peer-reviewed world-renowned research from the NIH and others is that at least 25 to 40% of the chronic illnesses that children now suffer from every day. It used to be more infectious diseases, although we have measles popping up and COVID and other things, but it's a huge array of chronic illnesses now that children have to suffer through. And it's not as though there aren't other factors, but if we don't acknowledge and address and work for solutions that include the environmental components, we are not going to get where we need to go. We are not going to change the paradigm of the increasing that we've been seeing decade after decade. It's at least 25 to 40% that have an environmental component. So this is our life. This is the life we swim in every single day, unfortunately. My mission is to make sure that I see and live through the day when we start to see these paradigm shifts changing. But unfortunately, I've been at this 25 years. Our organization, again, is 3 decades in. We've been seeing nothing but an uptake of neurodevelopmental delays, 200% since we've been keeping track. Childhood cancer is up 34% since 1975, the year I was born. Asthma, when I was in grad school at GW, they were teetering, and then we went down a little bit, but we haven't done much with childhood asthma as well. And again, many reasons, but environmental components and triggers are a huge part. While you may not lose your life with some of these, even though some of these can lead to death, the way that you're living through your quality of life and reducing a child's ability to go out for that soccer program or to get outside and play the way they want because they're worried about having an asthma attack, that's a reduced quality of life. And there are realities economically as well, but 10% of school-age children in the US have asthma. It might seem like a small amount, and these are just the diagnosed, by the way. Any school nurse would tell you. I know I have a lot more students that have upper respiratory issues, and maybe they're not officially diagnosed with asthma, but they're definitely having challenges. 1 in 34 8-year-old boys in the US have autism. I remember when that number was more like 64, and it wasn't that long ago. Zip code can actually carry more weight than our genetic code. This is where we're at. This is the US map, the more red, so you'll see a lot of the Petro Gulf South, a lot of high industrial areas. Not surprising that you also have, unfortunately, sometimes 10, 15, or 20 years reduced life. Now, there's many other factors that play, societal impacts, and we'll talk a little bit about those. You'll see Utah is kind of in a mixed range, but we are now living among the first generations to not be healthier than the generations before them. And with medical advancement, science, and an increased amount of money and capacity, never enough, but at least going into some of these areas, we should be seeing an uptick of changing the paradigm, and we are not. So getting into the polluted air, and I know our speakers today are going to be talking more about this, we know that from the Healthy Environment Alliance of Utah, which I know is on the agenda as well, there are elevated levels of air pollutants such as fine particulate matter, we call it PM 2.5, really nasty stuff that could get lodged in your respiratory system, sulfur dioxide, nitrogen oxides, and VOCs. These are these combination of chemicals that can turn into gases. A lot of them are results of industrial production. And this is a little bit of a table to give you a sense. So PM or PM 2.5, mostly from transportation, air pollution, industry, construction, even wind-blown dust, can lead to all kinds of respiratory issues and other challenges, cardiac challenges, heart challenges. Nitrogen dioxides and the nitrate families, combustion in vehicles, power plants, industrial facilities, you're kind of seeing the trend. This is all man-made creation right here, most of them. We have to do better. So in Salt Lake City, again, I know we'll be talking more about this. We do a lot of our work in coalitions, and that's really important because we're usually that child health voice at the table. How will said policy or lack of policy impact children today and tomorrow? We're constantly the one answering that question. So our friends at the American Lung Association put out this incredible resource. I really highly encourage you to check it out. Every spring around Earth Day in April, they release the State of the Air report. It gets down to the level of county level data and gives you a sense of the air pollutants in that county, and then compares it to how you're doing within the state and then across the country. So in Salt Lake City, ozone, short-term particle pollution and annual particle pollution tend to always resonate highly, and unfortunately, according to the last report in 2024, those levels are increasing. Now, nationally, the report finds that nearly 120 million people, that's over a third of the US population, have unhealthy levels of ozone. So again, it's not a unique situation that's happening here, but unfortunately it is something to keep track of. You are unfortunately on track with the rest of the country, which is not the way we're trying to go. We're trying to reverse these. And again, I want to stop and make sure we understand we are for all children, and it's not lost on us. There are subsets of our child health population that are doing even worse than the average child. Disparities are unfortunately a very real thing, health disparities here. You have higher incidence of asthma, and this has been throughout my entire professional career, has never dipped, in Black, Brown, Indigenous, and those children living in lower wealth communities. So there's a connection there to social economics, as well as we also know that a lot of point industrial places of pollution tend to be in lower wealth incomes and communities of color. So that is not that is unfortunately by design. It's not separated. That those trends are happening very much in unison. People of color are 64% more likely to live with a failing grade in an area with a failing grade from the report I just mentioned, and 3.7 times more likely to live in a county, getting down to the county level with failing grades for all 3 measures. Again, if you cannot focus in school, if you have a chemical that's impacting your normal brain development, what does that mean for your educational attainment? What does that mean for the days off of work and school for you and your family trying to get you the care you need? What does that mean for the amount of money being spent out of the home? I have an asthmatic child. Those inhalers, nebulizers are extremely expensive, and I have health insurance. So these are not the trends and the trauma and the stress we need to be imparting on our families. So that is the backdrop, right? That we have a pre-polluted population. Now on top of that, we have climate. And we have the impacts of the changing climate, which is now stirring it all up. I say often that I actually think this is the biggest children's environmental health issue of our time, because it exacerbates all the other triggers and all the other environmental exposures. So this is Paradise, California, the Camp Fire in 2018. It was one of the first really on record that started to set the tone that we were having regular now wildfire seasons, which I know you all are not too adverse to here. You understand this well. This was Los Angeles, just this last fall in 2025, beginning of this year. And then this is Graph Point Fire this July around you all. This is our regular, and it's to the point where we don't even have seasons anymore. Everything is running into each other. We know our climate is getting drier, higher drought conditions, and then on top of that, I know you have human activity, which only exacerbates all the above. So by escalating the greenhouse gas emissions from burning of fossil fuels and plastics industry, which is increasing, and also burning more fossil fuels and expected to have more incinerators in communities of color, it's like we're trying to set time back 30 years, not taking advantage of the lessons learned. We're trying to perpetuate the past, which is not going to work. Then you have these extreme events, so flooding, the wildfires, droughts, flash floods, all of it not conducive for our farming, for example. You can't plant a seed and sow a seed in too wet conditions or too dry conditions, so that also is adding to a crisis in our farming community. So now you have more water, you have more disease-spreading insects like mosquitoes, which then carry disease and add to the chronic illness and infectious diseases. You have increased mental health. Think about what it means, even if you live through a major episode as a young child, to see the stress and trauma that your family is going through. Maybe you've lost family members, maybe your home is destroyed, maybe your childcare in school is not inhabitable for months or years. What does that mean to your average schedule? Children usually need a schedule. It's really important for them to socialize, see their friends, see their community. All of this is increasing mental health and stress, and it's not lost on our children as well. I know we'll be talking more about the Great Salt Lake, but from a study done here at University of Utah, looking at the lake dust sediment, the chemical analysis indicates the presence of numerous metals in the dust, arsenic and lithium, and exceeding the U.S. Environmental Protection Agency's soil residential regional screening levels. So you see between 2011 and 2016, the lake is drying up, and I know that it's a very unique resource, and a lot of pieces of the country and the world are looking at how Utah chooses to handle this. Exposure to particulate pollution is rising from the dry portions of the playa, and it's highest among the Pacific Islanders and Hispanics, and lowest among white populations compared to other racial and social challenges. So you see this even playing out here in your region. With the rising heat index, every summer on record since we've been keeping track, and this summer will not disappoint, we are seeing an uptick of our rising heat index. That means potentially living more time outdoors. That is not what any of us want or children need. We all need to be outdoors in green space for physical activity, mental health. Children and seniors and other immunocompromised populations can actually experience heat stress, pregnant women in particular. It's very hard to focus and go to school when your classroom is getting warmer. Not every school in this country, a lot of our schools are in bad shape. They don't have the type of energy efficient ventilation system that would require. A lot of schools also don't have central air. So as months are getting warmer in April in some parts of the country and going all the way till maybe October, and you're in school during a good portion of that, that is an impact. And we know that there's decreased air quality with increased heat index. So why, again, are children more vulnerable here? You've got more casualties, more injuries among them, trauma, lifelong trauma. The 20th anniversary of Katrina is actually going to be this August. There were families that were displaced unexpectedly who then went to Houston, for example. Then you might remember Hurricane Maria hit Houston. So there are some families out here that have been hit multiple times by major weather events. The amount of disruption that creates for a family unit, food shortages, morbidity issues, parents out of work, schools closed, this is the kind of future that we are not really looking for. And I want to just make clear the intricacy of our insecurities and various systems that have been plagued for a while are not lost, and climate is also feeding into them as well. If you're already food insecure and you already have insecurity economically, employment insecurity, which is only going up right now with what's happening here in the United States, and maybe you also have K through 12 and childcare insecurity. Not everyone can pay for childcare. You probably are also high risk for being displaced or being the most impacted by a climate event. I wrote this report, Racism That Appends the Credo, with my friend Jackie Patterson with the Chisholm Legacy program. It was during the COVID pandemic. It's just one of many resources out there that just continue to solidify. Even in this modern era, we are still not learning from the past. We are still perpetuating the harms where certain populations are being hit the hardest and the worst. So now we're going to flip from that unfortunate, I see your body language, we're going to flip to optimism. History shows us prevention works. History also shows us when we collectively rise up, when more people raise their voice, when we put science and lived experience at the forefront, we can actually make change. So one example is we need to look at where children spend the majority of their time. Childcare, for example. Not every child's in childcare, but a lot of them are. And childcare is in a lot of different forms. Homes are in a lot of the situations, centers. Hester, that I mentioned, is our national director of this program and has been building it for 15 years. A lot of the stimulus is that there have been a few research entities. Most of the research is actually in housing. There's a lot out there on what people are exposed to, and certainly children. But there was a report in 2014 in California with one of our colleagues, Dr. Asa Bradman, who looked at 40 child care facilities. Every single one of the dust samples that they collected had high levels of chemicals, carcinogens, respiratory irritants, neurodevelopmental concerns that we would never want any child or the workforce, who are mostly women and women of childbearing age a lot of times, to be exposed to. So our answer to this was the Eco-Healthy Childcare Program. It's the only program in the country working for 15 years now to train and educate and provide technical assistance and leadership to childcare owners, facility managers, and providers. We focus on low to no cost steps that can be taken in a facility and sometimes outside to help support them in making sure that their indoor air is as healthy as it possibly can be. So these are just a few, majority of the components to our curriculum. We have a curriculum side. It's a 2.5 hour or so online training program. And sometimes we do show up in person to conferences and training events, but we are trying to help meet them. Here's the issue. How is this an issue to children? What can I as a child care provider do realistically that's not going to break the bank to make all of our lives healthier? These are some of the topics like air pollution and air quality. And again, we have these fact sheets. Everything is translated into Spanish for now. We'd love to get into other languages. And we have this endorsement side too. So you can get a 2-year endorsement. You can download this checklist. There's 35 questions. All of it has been peer reviewed by epidemiologists out there for us. You need to meet at least 30 of the 35 standards on there. For example, if you are in a facility built before the 70s and you don't do anything to test for lead or look at lead in your water, you will not pass. This is not an I got you moment. We're trying to support them in passing and becoming a part of our program so that we can support them along the way. And they receive a 2-year endorsement, and then they have to up that. So that's also a marketing opportunity for them. One of the examples of how we stimulate science. We are the national coordinator for the Children's Collaborative Centers on Environmental Health and Research Translation, funded by the National Institutes of Health. We have 6 centers across the country. Many, if not all of them, intersect with air pollution, and they work with community partners. So that is the model that works. Working with community partners, academic leaders coming in, conducting research together, research that has been identified and prioritized by the community, and the outcome is always stronger, and it is more sustainable because communities have been involved from the very beginning. Childhood cancer, I mentioned, is rising 34% since 1975. There are definite disparities in there. 1 in 5 diagnoses are among those at low wealth income levels. Also, Hispanic populations, for example, get higher leukemia diagnosis. That is not by mistake. There are some things happening there and where those populations tend to be and how they're exposed either at work, home, or otherwise. So our Cancer-Free Economy Network is another collaborative that we work in, just trying to change the paradigm of how we address cancer in this country. Everything has been treatment oriented. All the money that goes into cancer is always about finding a cure. What if you didn't have to find a cure? The best cure is to not have it in the first place. I'm not saying all cancers would be reduced, and I'm not saying all cancers have a direct environmental link, but there are many that do and have been documented. So we are trying to shift our economy. We have a huge dependence on these chemicals that we've been talking about. It's not just about saying we're just not going to use them. We need to make sure we have viable alternative science solutions so that we can get some of the products on the market, but make sure that they're healthy and not full and laden with chemicals that make children sick or potentially have a cancer diagnosis. So we're spending roughly $1 billion, and that was 2019, on hospital costs related to cancer. It's traumatic. Even to be a survivor is not a walk in the park. You are now higher risk for other chemicals because chemo and radiation also are laden with harmful chemicals. It's like you can't even win here. No family is going to say no to the treatment that their child needs, but it now means even if they're surviving more in this day and age, they're now living with a range of other issues: infertility, sleep disturbances, not being able to focus in school, or potentially hold a job in the future. That is not prevention. So we also have a childhood cancer prevention initiative, and we have a consortium growing. So would love to talk to anyone who might want to connect on your resources and bring your skill sets into the fold. This is a big tent. It's going to take all of us. How do we continue to make sure that we don't perpetuate harms and we give families the type of education and training and support that they need right now to make decisions, while many of us are also working on the type of policies needed so that families don't have to worry about the laundry detergent you're bringing into the home, or the lotion that you're putting on your newborn, or the food that you are feeding your family. It shouldn't even have to be a burden. We also have Healthy Air Partners. The American Lung Association runs this. We're working to ensure that all have access to safe, quality, accessible air. We all need this. This is non-negotiable to live. We need water, air, food. Everything else is kind of a luxury. If we don't have those, we're in a bad place. We're opposing threats on protections. We're trying to protect the EPA's budget and the CDC's budget and HHS's budget. We're educating policy leaders on how they can be champions, not getting in the way of future growth and development. There is a way. There are governors who are doing this. You can have progression. You can even have for-profit businesses, but they are sustainable, and you don't have to do it on the backs of human health and development. And we have the Beautiful for All Coalition. This is a huge, big, audacious, really conservation goal. It's the biggest conservation goal of our history. Why are we at the table? Because for the first time ever that I've ever seen, we have been infusing and making sure that public health leaders, community leaders, justice leaders, and those related goals are all intersected. It doesn't mean much, quite frankly, if we are protecting monuments over here and little pieces of land, but health is still skyrocketing. Those health indicators are still skyrocketing. This needs to be done together. There are so many co-benefits. If we can clean up our air, our climate implications go down, our negative health implications go down, and all the other benefits of nurturing what a life should have as far as a vibrant, healthy lifestyle to do all the other things people should do go up. It seems pretty important, but we're working to protect at least 30% of our waters, our lands, our oceans by 2030, which is a huge climate goal. We have urgent challenges ahead. There are proposed cuts to the EPA, 60-some%. The EPA's mission is to protect the public's health mission. I don't see how you do that by reducing the workforce when you have less people regulating our water, our air, our food. We have proposed cuts to the Department of Education, Head Start, migrant and seasonal Head Start. Again, this is not going to support families. This adds more stress and does not help them be able to live healthier lifestyles and make better decisions. We have immigration policies that are also impacting this work. We have halted NIH research. You cannot just turn on research and turn it off. That's not how it works. Columbia is facing $400 million. Other schools are also, unfortunately, being documented for more retaliatory type of things. This is not how we should be progressing. We need to be working together. There's an agricultural crisis, like I mentioned, and there are impacts to our national parks, which I know you all care a lot about. A lot of that workforce has also been cut, and those budgets are being cut. People need to be outside. We learned this during COVID. We need to have places for people to go recreate and spend time. And there are opportunities. You may have heard about, maybe you have, the Environmental Protection Network is a group of former Environmental Protection Agency staff that come together and actually pro bono provide voluntary time for most of their time. They provide technical assistance and guidance, and they did a poll after the last presidential election that said that 76% of Trump voters, 86% of all voters oppose attempts to weaken the Environmental Protection Agency. That is not what we're seeing playing out in DC right now. 81% of Trump voters, 88% of all voters want Congress to increase EPA's funding. And there is support to make sure that we don't deplete resources, but we actually increase resources and targeted measures to communities that are disproportionately being impacted. So we have a children's environmental health movement. We invite you all to it. It has to involve as many people as possible. This is a nonpartisan issue to make sure that children are healthy, that pregnant women get the kind of care that they need in education, and that we don't have to worry about the decisions being made every single day, like breathing polluted air, so that we can get to living our lives in a healthy, sustainable way. I have 4 children, like was mentioned. These are older pictures. Hester's children are in here, and a lot of our staff. These are just a few of the millions that keep me motivated every day and keep me very focused on the work that we still have. So it's an honor to be here. I don't know if we have time for questions now with the technical stuff, but happy to answer any questions or comments. And I know that was a lot. Sure.
Help with questions. So if folks have questions, please submit them on Slido. We have a few already, and we have a few minutes for questions. So let me just begin. Do you have any allies left in the new administration?
Yeah, let me start. Thank you. Let me start with the federal workforce. I mean, we have a huge amount of incredibly passionate folks who are in some very dire times right now. And they went through different, harder, challenging administrations, but this is a different thing that's happening. They're seeing their colleagues being let go without any reason. They're very worried about their own sustainability and livelihood. We have many federal workers that are now being represented and have law cases against the U.S. federal government, but that will take time. People are already dipping into their salaries. Most of us don't expect to go to work on Friday and not have a job by Monday without any due course. So there is a lot of concern and angst, but I would say our federal workforce, most of our nonprofit leaders out there, the coalitions we work with, are moving straight ahead. We're moving straight ahead. We definitely have had partners that have been impacted. Their funding has been stopped, again, for no other reason than they were working on climate change or working to reduce health disparities. So that part is hard, and communities are suffering in that way, and unfortunately that will continue. But the partnerships have not gone anywhere. In fact, they've strengthened, which is important.
In terms of policies, what are the most important policies from your perspective that could be adopted to protect children?
Thank you. We know that transportation, for example, is a big, big challenge when it comes to our air pollution. It's not the only, but if we can get a better handle on reducing the amount of vehicles on the road, gas, fossil fuel using vehicles, that will go a long way. It's very impressive to see the type of infrastructure that you all have here. Not all cities have that. The fact that your railways go out beyond your downtown, further out, allow people the option to take mass transportation helps to reduce the flow of traffic. So transportation policies that work on the type of vehicles on the road, we were going in the right direction, but now unfortunately this administration is not incentivizing our automotive industry. Now I've heard that the automotive industry is it's like research, you can't just turn it on and turn it off. They were already slated, many of you have maybe read, most of the major automotive dealers have already slated that majority of their fleets are going to be e-vehicles by a certain time. You can't just change that manufacturing manufacturing. They're already slated to do that. So I hope they still continue to do that for whatever reasons that are important to them. So transportation, we have an air big federal policy, the Clean Air Act. It's not perfect, just like the Clean Water Act is not perfect. Some may say maybe it's time to totally take a step back and create a brand new clean air policy. That's big and audacious, and I don't know if this is the political climate for that. I think making sure that we hold tight and support provisions that are already in these existing legislative laws is probably our best bet right now. So many of us are in the defensive posture right now, protecting what has been there, what has been working, and what is also showing that if we stay the course, we help our economy, we help our public health, and we also help the environment in process. So Clean Air Act, transportation would probably be my top two.
I'm going to take time for just maybe 2 or 3 more questions. What can we do to help impoverished families with respiratory issues for their children?
Yeah, and again, I've got my husband and a 15-year-old who suffer from asthma pretty bad, and I've seen how they can be triggered so quickly. First of all, it's having, hopefully you have access to a strong healthcare team. So unfortunately, if you're already diagnosed with an upper respiratory issue or asthma, it's monitoring it and managing it so that you don't have an attack. So finding out what your triggers are, making sure that the environmental realities of asthma are also part of the child's asthma management plan or for that family. Even in 2025, I am surprised to see how many times that's not the case. There's a lot of resources out there. Asthma and Allergy Network, and many of the ones even out here exhibiting, do have nice connections to resources. I'm happy to talk on breaks about some of those as well. I think asthma, unfortunately, is one of those that have been around for a long time. We know how to treat and support, but I'm really talking about let's make sure we have less diagnosis of asthma. So another thing would be counseling and figuring out who in your community are respected. Maybe it's faith leaders, maybe it's school nurses, whoever works, community leaders, to educate them on some of the triggers and some of the ways that you can reduce exposures at home, at childcare, at school. School boards are a big part of this. That's a big part of it too, so that we don't have onset of asthma. We're trying to reduce the onset. And for those families that are dealing with it, making sure that they have resources to contain it so it doesn't get even worse for that child.
Are there things that states and localities can do about things like indoor air pollution that aren't governed by the EPA?
Yeah.
Or do you have examples of success stories in other conservative states?
Yeah, so one of the ones that we're trying to lift off in our eco-healthy childcare program, for example, and is being used in places like Maryland, Minnesota, New York, and other parts of the Midwest, no idling policies. It costs nothing. So there are schools in its law to have no idling buses. I think we all understand how much diesel, usually if it's still a diesel, older yellow bus, it's just sitting there. And I know that they've said that there are reasons. You all can have a very cold climate here, and then it can get very hot, and they say that they're leaving the air conditioning on or the heat on. That is not enough for the amount of pollution that happens. It may seem small, but if we had no idling policies around schools, childcare, and other places, places of work, that would be huge, number one. Also, we've seen a lot of indoor air and outdoor air policies where a certain proximity of the building or around the certain building, it's a no idling zone, but there's other sources too, like there can be no industry a certain mile from, point polluting industries where children spend a lot of time. We're trying to reduce those anyway, but if they're in the community, thinking about the siting of some of these things has also been working. That takes community, working with the commissioners, working with the elected officials for sure. It is not easy, but when the pressure is on, that's usually when things start to happen.
Okay, last set of questions. Are there things that people can do in their everyday lives to help with this? And you mentioned a number of future events or other ways people can get involved to help this movement. What are those?
Yeah, thank you. And I encourage you to check out our website, CEHN.org. Also we've got a whole list of resources. The Eco Healthy Childcare Program has a lot of individualized resources, again, pertaining to air. So for example, pesticides. Pesticides are not what we promote. We promote integrated pest management, meaning if you don't have a huge inundation of ants or some other critters, there are many steps that can be taken indoors to reduce them even wanting to be in your kitchen or wherever the situation is. So we have guidance on that. If there is an infestation that's different, then that needs to be handled. A company needs to come in, and ideally they're using the least toxic measure, but it's the last step. No one should be in that facility facility, that building, that occupational environment for like 72 hours. It's rare that you see that happening. So those are some of pesticides and how we handle pests. That's a big deal. Also, ventilation is huge. Making sure that maintenance of ventilation systems in buildings, homes, schools are as up to date as possible. If the airflow is polluted or it's full of mold, for example, and it's not we learned this during COVID as well, that's a big part of getting pollutants out and actually working them through the filtration system that's supposed to pick them up. There are many other steps that we have, not using aerosol cleaners at all, and thinking about the type of cleaners that are used indoors, thinking about the type of furniture that is used. We're not telling people to go buy new furniture and new flooring today, but when you're able to do it and you're thinking about it, there are many other options that were not available even 10 years ago, and we can certainly help provide guidance. We try not to pinpoint certain industries. Specifically, we try to inform the consumer on what they should be looking for and avoiding.
All right, well, thank you so much. Another round of applause for Nsedu Obot Witherspoon.
Thank you so much.